Now, if the internal carotid artery is something called the carotid sinus, which has its origin on the internal carotid artery. So there's the internal carotid artery, and there's the carotid sinus. It gets its name because it's on the carotid, and it has an expansion, and so sinus means a space. It's a baroreceptor, which means it senses changes in blood pressure. So think of a barometer, which senses changes in pressure in the atmosphere. A baroreceptor senses changes in blood pressure, and it's part of what's called the baroreflex. And so let's use this picture to show that. Well, there's our common carotid artery, which gives rise to the internal carotid artery and has its origin, has the carotid sinus, which is a baroreceptor and senses changes in blood pressure. And let's say that there's a drop in blood pressure, you initiate something called the baroreflex, that the cranial nerve 9 sends this information from the carotid sinus to the brainstem that says, hey, our blood pressure just dropped. We need to do something about it. So the brainstem does the following. It has a sympathetic discharge, which increases mean arterial pressure, increases heart rate, and affects the kidney, which then through the renin, angiotensin, aldosterone system helps to bring blood pressure back to normal. The brainstem also takes parasympathetic or vagal tone to reduce heart rate in this case, to reduce the vagal tone so that the heart rate can increase. Basically, the carotid sinus initiates a chain of events with sympathetic and parasympathetic discharge until the carotid sinus senses blood pressure as being back to normal. All of that is initiated by that carotid sinus. Now, the carotid body is located between the internal and external carotid arteries. Internal, external carotid arteries, and there's the carotid body. This is a key